Substance abuse, depression, and mental health issues. They are devastating illnesses, especially if left untreated. Here to talk today about depression is Alexis Barron. She's the Director of Clinical Service here at Copper Springs. Good to see you.
Good to see you as well.
So let's talk about this facility. What do you provide for patients here?
So we actually offer both inpatient and outpatient mental health and substance abuse treatment. We have both an inpatient facility where we can work with people that have concerns that they are a danger to themselves or have ongoing psychosis and just need a place to stay to kind of just a couple days to get better, see a psychiatrist, see a therapist, and really get them back on their way to the outpatient.
So what is depression?
Depression is a mental illness or disorder that affects so many people in the world. And it really is, people think of it as just this really intense sadness. I think of it more of as a numbing. People don't really feel emotions anymore. I talk to patients all the time where they said, I wish I could cry. I wish I can yell. I wish I could feel something. It happens so often, and especially because we kind of go down this spiral, and just by feeling sad, we just continue to do things that are hurtful to us and that keep us going down. And you just kind of wake up one day and you go, oh wait, I don't know how to live like this anymore.
Are there warning signs? What should we be watching for?
Absolutely, there's tons of warning signs. Some of the concerns that you want to look for is either a weight loss or weight gain, not based on them dieting or anything, but just kind of naturally happening. Also either sleeping a lot, where they're just constantly in bed, or even the opposite, where you just constantly can't sleep. You really have insomnia and you just cannot get any bed. But really, isolation is a really big concern, and not wanting to be around other people, because oftentimes people are depressed, they don't want to put their problems on anyone else, and so they just rather stay away from everybody because it's going to hurt their family members if they see them.
And unfortunately, internalizing is probably one of the worst things that you can do.
Absolutely. One of the things that I tell people all the time is the moment you hear that little voice that says, I don't want to tell anyone, that's when you have to avoid that voice and say, yes, I need to talk to someone.
And come in here to Copper Springs.
Exactly, for sure.
Assisted. So as a family member, if you are, seeing these signs with a loved one, when do we approach them and how do we approach them about getting help?
The best thing that you can do is go to them and listen. One of the things I hear most often from patients that have the mental illnesses are that their families don't understand. They say, just get up, just get better. You can pull yourself up by your bootstraps. But saying to the family, I understand that you're having a really hard time. Let's look into see if we can get you someone to help. Let's call the National Association of Mental Illness. That's a support group that's open 24 hours a day for both family members and patients. Let's call a crisis line. Let's call someone that you can talk to.
What services can you give these folks?
So we have two different programs here. We have our inpatient program where they come in and they stay, as I said, about a week. During that time, they see a psychiatrist every day. They meet with a therapist every day, doing 2 groups a day as well as one-on-ones. We have a family support group every Saturday where the family members can come in with the patients and really talk.
That's critical, right?
It is. It's so important. And they can get some medication changes and kind of really focus in. We also have our outpatient program, which is all group oriented, because group is so important when we're talking about depression, so that they know that they're not the only one that have these issues. We have a partial hospitalization program, which is a 5-day-a-week program all day long. So if they're not quite ready to be in the hospital, but they need a place to go, we can go there. They see a psychiatrist once a week. They're with a therapist for 5 hours every day.
Wow. Really
intense good work. And then we have our intensive outpatient program, which is 3 hours, 3 days a week. Again, a group situation. Really try and focus in and make sure that they are doing well, and that can last 6 to 8 weeks.
So if you or someone you know is suffering from depression and you need help, please contact Copper Springs. Here's their contact information. Call Copper Springs Hospital at 480-565-3035 to schedule a no-cost assessment 24 hours a day, 7 days a week. They're located at 10550 West McDowell Road in Avondale. The website, copperspringshealth.com.